Hey, so we're going to talk about neurotransmitters like dopamine, serotonin, histamine, and GABA, and we'll compare the symptoms so you can figure out which neurotransmitters are the potential culprit of your insomnia. And then we'll look at the options for sleep aids and medications. So catecholamines are dopamine, norepinephrine, and epinephrine. You're likely going to have difficulty falling asleep, might have generalized anxiety, elevated blood pressure and heart rate, possibly chest tension and palpitations. Anger and rage is also a good marker. Now, histamine, your body has a system which it releases epinephrine when it becomes high in histamine. Just think of anaphylaxis reaction from histamine overload, say like peanut allergies, right? That will cause your body to release epinephrine. And also you can take epinephrine shots to clear out the histamine. The most notable symptoms will likely be itchiness and brain fog, possibly runny nose. 5-HT2A, that's serotonin 2A receptor. So it's a receptor for the neurotransmitter serotonin. You're likely going to have trouble falling asleep, situational and symbolic anxiety. Impulsivity is a really good one as well. GABA issues are one of the most common causes of insomnia. So difficulty falling asleep and staying asleep, possibly have bad dreams, and you might frequently get jolted awake with like sudden muscle contractions. Say anxiety is like generalized anxiety or anxiety from anticipating something in the future, like a future event. But when it comes to it, you may perform rather well. HPA axis, that's hypothalamus, pituitary, and adrenal axis dysregulation. You'll likely notice being tired during the day, but you feel awake at night. Say if you suddenly wake up between like 10 p.m. to 2 a.m., that's a pretty good indicator. If you have heat intolerance or say during the winter in a rather, like a room temperature when everybody else is wearing a t-shirt, but you need a sweater. I did a video on low endorphins, so you can watch that if you feel like you resonate with these symptoms. I'd say achy muscles and joints, and also physical fatigue. Not mental fatigue, but like physical fatigue and muscle fatigue. Now we're getting into lists of medications and other sleep aids. You can look in the brackets of what neurotransmitters they are known to affect. So quetiapine, that's often known as Seroquel, olanzapine too. These are antipsychotic drugs, and they are quite potent, but I noticed that they can make you like really tired the day after and also prone to anger. Prazosin is an alpha adrenergic receptor antagonist. It's definitely not something you want to try as your first. It would be good if you have generalized anxiety and maybe like heart issues, but it does have to be taken continuously. And alpha blockers and other adrenaline blockers does have some nasty side effects. L-methionine and SAMe, that's S-adenosylmethionine. These are supplements, right? So they're quite easy to obtain, but it's probably going to work only if you have low COMT, so catecholamine O-methyltransferase. That's an enzyme that breaks down catecholamines. Cyproheptadine, I like this one. It it feels a lot cleaner than the antipsychotics like quetiapine and olanzapine and others like it. Fatigue the next day, it can happen. There's like a fine threshold where it works well, yet not causing like a fatigue the next day. That's around 1 milligrams, I would say. Melatonin is notoriously known for being not effective, but what you want to try is right before you go to bed, you pop some melatonin and see if that works, and just like make sure you lay down right after. Lemborexin, surorbexin, these are orexin antagonists. Orexin is like your awakefulness neurotransmitter. It's expensive, but what I notice is the side effects are quite manageable. In the beginning, it might make you depressed next day, but and also you could get like sleep paralysis too. Benzodiazepines, so say clonazepam, Xanax, and Ativan. These all have quite a high risk for abuse and dependency, and the withdrawal periods are very long and very harsh. So yeah, I might do videos on harm reduction in the future, but for now, what you can do is to take these drugs just once a day and don't raise the dose. And that is a really good way to be able to take this continuously for, not too long, but long enough for you to maybe figure out your insomnia without harsh withdrawal after. So similar story with the gabapentinoids. Z drugs, zolpidem, zolpiclone, zolapolone, S-zolpiclone. These do help you fall asleep, and it can give you some euphoria if you choose to stay up on it. Very high abuse potential. Probably not as bad as benzos. Yeah, it can wipe your memory, and I do notice like feeling anxious and tired the next day. Trazodone has a broad mechanism of action, even at the sleep aid recommended dosage. It's like 25 to 100 milligrams, right? That's on the lower side. But even then, it can work to reduce excess serotonin, norepinephrine, and histamine. It can make you a little bit sluggish in the morning, maybe a little bit anxious, but it doesn't last all day, like quetiapine and olanzapine. So I would say this is overall a pretty good sleep aid. Buprenorphine, you're probably only gonna need it if you have been abusing opioids or if you were taking painkillers for extended period of time. And also if you take it at night, it could be overstimulating. But the nice thing is it has a pretty long half-life, about 36 hours, I believe. Low dose naltrexone, this can be taken at night, but it does have to be taken continuously. So HPA, axis dysregulation. You might call it adrenal fatigue too. I'd say the only reliable form of sleep aid that's going to work for this that I found is the phosphatidylserine. Serene. And this is a supplement, so easy to obtain. So diphenhydramine, that's an antihistamine. You might have like Claritin, you can use other antihistamines as well, but it's probably only going to work for minor insomnia. Yeah. Cannabis, you know about cannabis, marijuana, yeah. It can be addictive and maybe make you tired the day after.